Hi, everyone. I'm Kira Sorrells, and this is NICUnity. NICUnity is NICU Parent Network's all-encompassing educational initiative to foster a culture of belonging for all members of our community. This initiative is made possible by the generous support of Chiesi USA. Chiesi is a privately owned, research-focused pharmaceutical company committed to infant care for over 3 decades. As a sustainable company accredited with both a B Corp and a benefit corporation status, Chiesi strives to make an impact through forward-looking and impactful initiatives that benefit patients, patient families, providers, and healthcare organizations. Chiesi recognizes and appreciates the vital role that patient families play in the care of babies in the NICU and is proud to support the NPN community. You can visit their NICU Connection site at NICUconnections.com to learn a little bit more about what they do. So our monthly schedule of NICUnity offerings includes discussions, leadership lounges, and special health topic webinars that bring together NICU parent leaders, adult former NICU patients, healthcare partners, and maternal infant health stakeholders for candid discussions about diverse experiences in the NICU and beyond. Through this work together, we want to shine a light on those who are often marginalized, silenced, and underestimated, and we are thrilled to provide this platform for these authentic conversations. So thank you for joining us as we embark on this journey of learning, growth, and unity. Together, we will build a stronger, more inclusive NICU community, one conversation at a time. So for today's NICUnity health discussion, we are recognizing Prematurity Awareness Month. And I am delighted to be joined by Tracy Pella from Connected Forever and Sophia Rosenblatt from Saul's Light Foundation. Today's discussion is centered around the European Foundation for the Care of Newborn Infants theme for World Prematurity Day, Access to Healthcare for Everyone. This discussion will delve into some structural issues families encounter in Louisiana and Nebraska. We'll explore how intersections of race and gender and poverty and other social factors shape family experiences in the NICU and beyond. So with that, I'm going to bring our first guest on stage. Tracy's professional background is in school psychology and mental health, but her proudest title is mom. She has advocated for children and families in the mental health and education field throughout her career. Tracy is the founder and president of Connected Forever, a nonprofit organization based in Nebraska. After giving birth to twin boys at 23 weeks, resulting in the passing of her son Cohen, and Cooper spending months in the NICU, she was driven to establish an organization to support families on a similar journey. Tracy's professional and personal experience, paired with her passion and commitment to support families, has made her a valuable resource. Tracy, thank you so much for being with us. It's so great to see you. Sophia is having some technical issues, so hopefully she'll be joining us, but we will just jump right in.
Well, thank you, Kira.
Hold on. I think we've got Sophia coming, but if you could, Tracy, let's just start off and just share a little bit about your experience, your personal experience, obviously with your boys, and kind of how that prompted you to start your organization.
Yeah, so we were elated to find out we were pregnant with identical twin boys in 2011. Pretty quickly, we started to develop the dreams about what life would look like. We're also a farming family. So to be able to have two boys grow up on a farm was literally a dream come true. And we quickly realized that we were a high-risk pregnancy. And we started to go to multiple appointments. At that time, we did live about an hour away from our providers. And so we were doing multiple appointments. And at our 23-week and 4-day appointment, appointment, we actually were told that if we wanted our boys to have a chance to live, they had to deliver immediately. So very quickly, we became parents to 23 weekers. And as you had mentioned in the introduction, our son Cohen did pass away the day that the boys were born, and our son Cooper spent 134 days in the NICU. During that time, again, we were a rural family, so we were commuting, we were taking time off of work, and really what I was seeking as a mental health professional, and just from my personality, was a community. I so desired to find someone that had been in my or had a similar experience to me, and both through my grief and in trauma through our birth, and also to bring home a micro preemie, having no medical background. That was just an area that I really sought that there wasn't a community for that. And so actually a few years after that, one of our dearest friends also lost their infant son. And that's really what kind of propelled us forward to really make sure that Nebraska families were supported through their pregnancy and infant loss or a NICU stay.
Yeah, I remember because you and I met before you started Connected Forever in a virtual kind of support group for moms who had lost one or more multiples. And I just remember meeting you through that. And I remember, I still remember sitting in the parking lot after dropping my 2 surviving triplets off at school and talking to you about this idea that you had about starting Connected Forever. So it's really just wonderful to see how much your organization has grown and how far you've come in all these years. So we do have Sophia with us. I'm so excited to bring her on stage as well, and we'll hear a little bit more about her background. Hi, Sophia.
Hi, good morning.
Thanks for being with us. Technology is wonderful when it works, right?
Oh my gosh, I know. Just me trying desperately to switch browsers and get on.
Well, you're here, and that's all that matters. So thank you so much. So Sophia Rosenblatt is the Director of Programs and Partnerships for Saul's Light. She has served in her position for the last 2 years and worked for a year as Saul's Light's program coordinator. She is an alumnus of Hive program for repro leaders and is training to become a doula. Sophia says she's driven by her passion for reproductive and birth justice in Louisiana, as well as her belief in the power of mutual aid. It is her belief that every birthing person should have equitable access to quality care and that we need to address the barriers that prevent that from happening. So, Sophia, thank you so much for being here with us. So can you tell me a little bit, I know you don't have a personal NICU experience, but what is it, do you think, that kind of has driven your passion for birth and reproductive justice?
I think it is really just my belief that everyone should have that equitable access to care across the spectrum. When I started with Saul's Light, I did not know that much about the NICU or preterm birth or anything like that. And I think over the past, I guess like almost 4 years at this point, working with Saul's Light and doing this work, you just kind of really realize the spectrum of experiences that people have and how important it is that there is just a standard of care that crosses all the lines. But there aren't families that are falling through the cracks because they don't have that same access to resources or they don't have that same community support. So I think that, over the course of like the past few years, it's really just been something I've become more and more interested in. Becoming a doula now has been really cool. You just get to see a more also like embodied kind of way of looking at birth. So yeah, I think that, it's just the past few years have been really inspirational. Working with Kimberly has been, a huge motivational factor for me as well.
Absolutely. Absolutely. So, could you tell us a little bit more about Saul's Light and how you serve NICU and bereaved families?
Yeah,
What kind
definitely.
of services do you provide and that kind of thing?
Yeah. So Saul's Light was founded in 2015 by Kimberly and Aaron after the passing of their son Saul. at a NICU in New Orleans. So Saul's Light really tries to address the different barriers that families face in the NICU, or what families face when they experience a loss. So this can be, anything from financial barriers. So we help out with financial assistance. We really trust families to know exactly what they need. So we provide some direct cash assistance, connection to different community resources. We also provide mental health support. So, connection to different peer support, connection to counselors that specialize in postpartum and perinatal mental health. And we really just believe that access is the most important thing, and quality access is the most important thing, and that people should have the option to have choice, should be able to communicate with providers or community organizations in their own language. So we really just try at Saul's Light to address these different barriers from a point of what can we do to best meet this family where we are. So yeah, those are some of the services that we provide, but it's really kind of unique to the family. We're just kind of like working with them throughout the whole NICU journey to see what their individual needs might be.
Right. And that's, I think, one of the most critical pieces of healthcare is, every individual is an individual, right? Every person is different. Every experience is different. And you really do have to know, what's going on in their lives outside of whatever medical condition it is that's being treated, because that's really going to influence a lot of other aspects of how they're best able to be supported, and how you as a healthcare professional or a community support organization can help to meet those needs. So Tracy, what about you? Tell us a little bit more about Connected Forever and how you serve NICU and bereaved families.
Yeah. So we have been around for the past 10 years. Our programming has definitely evolved and really to meet the needs of families in Nebraska. So we do serve families that either reside in Nebraska or in a Nebraska hospital. And we do that through programming on both sides. So our programming, a lot of times families are utilizing both NICU or bereavement services. But in the NICU, we do have a NICU mentor that goes bedside. We have one-on-one mentoring for families across the state. We have different in-person support groups, events, and then we do a lot of staff education in connection to resources and advocacy across the state too. So.
That's great. Thank you so much. So you started to touch on this a little bit, Tracy and Sophia, both in your intros in terms of the parts of the country that you work in. So Sophia, you're based in Louisiana. Tracy, you're in Nebraska. Sophia, let's start with you. Can you kind of describe what I'll call the climate of healthcare in Louisiana? I've lived in Georgia and Mississippi for more than half my life, and particularly the time in Mississippi was when I was in my, the beginning of my NICU advocacy career, and we were always, the best of the worst. We were always, one of the highest in infant mortality, one of the highest in maternal mortality, one of the highest in preterm birth. Can you tell us a little bit about Louisiana, because they're neighbors?
Yeah. I know when you said that, I was just like, Louisiana is always second worst to Mississippi in like the way that it's ranked throughout the country.
Yep.
So yeah, I mean, I think that in terms of the healthcare landscape for birthing people in Louisiana, it's pretty difficult to, put it lightly. Our preterm birth rate is 13, I think it's 13.4 right now. They just came out with a new report card through the March of Dimes. So we have really high preterm birth rates. In some parishes, it's almost like 18%, which is,
wow.
Truly, it's crazy. It's really kind of like just unacceptable.
Yeah.
Infant mortality, especially for Black families and Black babies, is incredibly high in Louisiana. And it's just kind of like, there's just like a problem too with like in the rural parishes where a lot of the community resources, a lot of like the big hospitals that have the high level NICUs are located in New Orleans or in Baton Rouge or in one of like the big cities. And so a lot of the rural parishes end up really getting left behind, or families have to face considerable barriers just to get to their baby in the NICU.
Mm-hmm.
So, it's not good to
Yeah.
put it mildly in Louisiana right now in terms of preterm birth and infant mortality.
Yeah. Tracy, what about you? I mean, I always just think of Nebraska. Of course, I know you personally, so I know that you are a farming family. And so that's kind of what I equate with Nebraska. But I know Nebraska is also a very large state. But can you tell us about kind of, again, that societal and, kind of healthcare climate in Nebraska?
Yeah. I think, our most recent March of Dimes, I think we came out with, I think we're a D. Our preterm rate is, I think, 11.1, down just a smidge prior to the last report. Infant mortality, same. We're seeing that across the state. For us, it really is the rural families, not in the lack of access. Even in Nebraska in the past few years, we have seen some birthing centers close. Almost a significant amount of that. So that is increasing our lack of resources and access to families. We have one level 4 NICU in our state, which is on the very eastern edge, and probably across our state is about a 6-hour commute. And so, and even within that specialist, our access to specialists is very difficult for families. Any family that is outside of our, I would say, our largest cities, Lincoln and Omaha, either they're commuting and driving to those specialists, or those specialists are commuting to them, which is typically at most about once a month. So families are, and even to get to that specialist, are driving still hours to be able to have access to the best care possible
Right.
across our state.
Yeah. Similar in Mississippi as well. I remember when I had my triplets in Atlanta, and we lived like an hour outside of Atlanta. You can't get anywhere in Atlanta without driving at least an hour. But there were many hospitals, many specialists, many practices with several specialists. So we had we were able to kind of pick whenever we needed that higher level of care after the NICU. And when we moved to Mississippi, I asked the pediatrician, well, I need a pediatric nephrologist. And she said, there's one. And I said, one in the city? And she said, no, one in the state. And I was like, wow. I mean, it had never even dawned on me that would be a reality. But it is in many parts of our country, just like you said, where, the waiting lists are months long to get to that specialist. So let's talk about this, Sophia. What can you tell us about kind of the structural systems at work in areas of healthcare that make accessing those services for families particularly difficult? I mean, I heard you, you talked about the rural. I heard you talk about financial resources. So let's talk a little bit about those social determinants of health and how that plays into access to healthcare.
Yeah, I mean, I think that there is a huge problem with having these big institutions like hospitals, located in the big cities with people. And I don't know, Tracy, when you're talking about it, I was like, it sounds like kind of similar in terms of people having to travel like really huge distances. Like we've worked with families who live in Monroe and they have to travel 4 hours to see their baby in New Orleans. And, sometimes it's also like they travel and they have like no place to stay,
Right.
like they're seen as separate from their baby, even though they're not when their baby is in NICU.
Right.
And so it just ends up being these huge financial barriers. We've had families that we work with who live in New Orleans East, which is the other side, of the city. And if you don't have access to a car, that's like $50 each way for an Uber. So there's just this huge financial disparity, and there is no built-in institutional support to help out with all of those costs. Or even if there's some funding available from these like hospitals or things like that, it is not something that is guaranteed for families. It's not something that if you have a baby in NICU, you are guaranteed to be able to be bedside. So a lot of what we look at when we do our work is what are the barriers which prevent families from being able to be bedside. In Louisiana, a lot of it is, not having access to reliable transportation, living really far. Sometimes I think about just like in terms of like Medicaid coverage too, and like trying to access things like Medicaid transportation, huge barriers along with that. I think about families who, they immediately have to go back to work after they give birth and have the baby in the NICU. So there isn't the time to be able to see their baby every single day. And, sometimes they also experience judgment from providers because of that, even though they financially are just not able to do it. And they don't have, sometimes people have other kids. They don't like have people to look after other kids while they visit their baby in the NICU. So I think that there is just these many different levels of things that prevent families from being able to be bedside. And I think that there also needs to be more of an understanding and from like an institutional level from these hospitals and from these providers of the different situations and social determinants of health that contribute to families not being able to be there. And from there, I think then we should be able to do the work to figure out, okay, if these are the barriers, what do we need to do to make sure families have the ability to do that? And, it might be on like a legislative level for policies, might be on like a hospital level for providing more resources. But I think that's kind of like the area at Saul's Light we try to look to address too.
Yeah. Tracy, I just saw you nodding your head through the entire time Sophia was talking. So I imagine, a lot of what Sophia is saying, rings true in Nebraska as well.
Yeah, very much. I mean, I could almost repeat verbatim what Sophia said. I mean, I think that's exactly so many of the barriers that we are seeing. I think an additional one, providers, institutions are trying to use technology, but we're also seeing technology disparities for access to technology. I mean, we still have places in Nebraska without Wi-Fi, without access to, good, stable internet. So, I know, especially in the mental health field, that is an area that has grown a lot of trying to use technology, but it's still creating obstacles for families to access that care as well. But yeah, definitely, we see many of the same similarities for our families trying to be bedside. And there is just so much more to it than not wanting to be there, but all of the barriers that they're facing to be there.
Yeah, absolutely. I mean, we, certainly are champions for family-centered care, but the family has to be there first and foremost. And we already know that, the NICU experience is, traumatic. It's life-changing. It, can significantly impact the parents from a mental health standpoint. And then when you layer on these other barriers, it just adds to it. And then you mentioned the judgment, the feeling of judgment of not being able to be there. And unfortunately, we know that is true in a lot of cases. And Tracy, I'm glad you brought up the fact that about technology, because there are incredible advances in technology, I think, particularly since COVID. But what if you can't access the technology? Not everybody has a smartphone. Not everybody, like you said, lives in an area where they can have a Wi-Fi connection. So, that's something that I would like to see addressed from a legislative standpoint in some way. I'm not sure how, because that's not my area of expertise, but it seems like, when we're talking about access, we're really looking at how can these families be with their babies. So let me ask you guys, what do you see as something that could be done on a national or collective level to address some of these issues?
I mean, I think that there's definitely, at least in Louisiana, I think there has to be changes that are made on a policy level. I don't know I guess like leading up to this, I was kind of just thinking about like this last legislative session where, we had so many maternal child health bills that we brought, or like not as personally, but like that were in session, and they were like, by and large, most of them were just like struck down. And these are things that would have been so helpful for so many families, like NICU and just birthing families too. And so I really think it's just going to continue to be, like a need for advocacy to, to see policies that have like worked in other states that could work in our states, to be able to like figure out ways in which that could happen, ways to build coalition and move it forward. So that's something that comes to mind. And I also just think about like community organizations, like, I don't know, I think about also things like mental health support and how important that is and what a barrier families have to that as well. Like there's a huge, like the biggest reason I think that families, don't access mental health services is just that, the cost is so high. And there is like sometimes only like a limited amount of therapists that are offered as like options, and families should be able to have choice, So I think that there's just like, there should be ways in which that really low or no cost mental health services are available to families. I think that's just such an important part of, really addressing some of these unique challenges, and on like a really interpersonal level, making families feel seen and heard and understood.
Yeah, absolutely. What about you, Tracy? What are your thoughts on that?
I definitely agree with, as a state collectively. I think for us, I do feel like Nebraska in the past, I would say year or two, even just bringing our voices together, I find that there is such power in collaboration. And I do, we do have some organizations that are really bringing key stakeholders together to even start these discussions. And I think that it is huge for us to have people together at the table to talk about what do our families need, what are our unique needs across the state that need addressed. And I think I do find that that is happening a little bit more. And so I'm really proud of that. I do think for me, having a passion for mental health, I think, and this is probably across the country, I can't really speak to that, but definitely Nebraska is just a lack of providers. So I do think that there are maybe some ways that we can address, even continuing to share about the need for mental health providers. I talked to a provider just yesterday, and she told me that, and she is in the maternal health world, and her wait list is 2 months. And so that to me is powerful of the need to access the need. And so, we can be referring, we can connect families, but to have such a long wait list, unfortunately just isn't meeting the needs of families right now. So.
Yeah. That's a significant roadblock when you don't have enough support to meet the needs. So before we close up, are there any kind of final thoughts or anything that we didn't cover that you'd like to make sure that we talk about in our last couple of minutes?
I think that we kind of covered a lot of the points that I think are so important. And I think it's actually, I don't know, it is like really interesting to hear, Tracy, also you just talk about your experience working in Nebraska, because I do think there is like, I don't know, a lot of it just like really resonates in terms of like access, in terms of rural areas. And, I don't know, when you were talking about like technology, I was like, oh yeah, we like experience that so much with families. And I was thinking about it also in terms of just, families who like don't speak English and all of like that.
Absolutely.
Access.
Right. Yeah. So we had somebody comment about the language barrier and how that is a challenge. How does that show up for you in your work in Louisiana?
It's like a huge, huge barrier. A lot of the families that we work with who are Spanish speaking, there often won't be someone in the NICU who speaks Spanish. So they end up having to use like a language line. And that's also for just like legal HIPAA purposes too. And that faces like a lot of barriers because there's so much like intense information that's being communicated, and to have it communicated solely through an interpreter who is like not able to, express maybe the empathy that's needed for that situation. And that's a major barrier. A lot of the information, that's just there around the NICU is not in Spanish. So, the importance of having things that are in English, in Spanish. And, I think about also families who are like not documented, and, with their coverage, if they have Medicaid while they're pregnant, their coverage ends by the end of the month. So if they give birth, sometime like near the end of July, by like July 31st, that coverage is ended. And, it can be that really, And I think that's, a lot of the difficulties with like Medicaid expansion and, it not covering, not covering all families.
Right.
So,
Yeah. I mean, we talk about so much about the importance of the fourth trimester, right? That
yeah.
we can't have coverage end just because the baby's been born. I mean, there's so much more that birthing people need in those months following a delivery, and especially if it's a NICU delivery.
Mm-hmm.
Wow.
Yeah, definitely. Yeah, but I think that there's just like a lot of specific barriers that families who don't speak English face. And
Mhm.
I don't know, I think that something else that we're really trying to do is just provide that kind of like peer support and counseling in other languages as well, because I think being able to communicate those feelings,
Mhm.
you know, in your home language, I think that is so important as well.
Yeah. Yeah, I think that's a really good point, because I don't think people realize, the interpreter services aren't necessarily trained in trauma-informed communication.
Mhm.
So they're just, saying what, what is being told to them to say to the parents, but the delivery of that information. I mean, we know how important communication is for
Mhm.
families and their mental health and how they experience and navigate and cope. And yeah, that's something that I also had not thought of, but you're absolutely right there. What about you, Tracy? Any final points or things that we didn't cover, or anything that really resonates with you? I think it is interesting because when we asked you guys to be here, I didn't really think about Louisiana and Nebraska as similar, as having these similar challenges and barriers, but there really is a lot that's very similar. Like, it seems like maybe we need to reach out to some of our other community-based organizations that that understand these types of disparities, and having a large portion of the state be rural. That perhaps that might be an opportunity for coalition building.
Yeah, that would be great, because yeah, definitely listening to you, Sophia, I feel like as Kira said, I'm over here nodding like yes, yes. I think we just see so many similarities, and I think I think there's just so much more work to be done, and that there is a lot of room for collaboration across the country, and definitely within our own state, to ensure that we are providing access to families.
Yeah. Great. Well, thank you guys so much for being here. I think this has been a really kind of eye-opening discussion. I think it will be for those that are listening. So I just want to thank you, Tracy, and thank you, Sophia, for being here, and to everybody else for taking a few moments to join us. We are very intentional in our efforts to make participating in our NICU Parent Network educational offerings as simple as possible. We will be taking a little break in December, but we'll be back with new sessions in January. So everybody have a wonderful rest of your day.
Thank you.